AMAC's Medicare Tip of the Week: what you need to consider before canceling your current coverage. Insurance can be frustrating, especially when your plan doesn't work the way you thought it would. But before you terminate your policy, you need to understand what your options are. You may have to wait a long time to get covered again, or be left with no coverage at all, depending on your plan type. Medicare Advantage Plan Part C and Prescription Drug Plan Part D enrollments are done on an annual basis. This means that once you enroll in this type of plan, you're essentially locked in until the end of the calendar year. You may only switch your plan or make changes during the Annual Enrollment Period, or AEP, which runs from October 15th through December 7th each year, unless you have a Special Election Period, or SEP, that would qualify you to change plans outside of this window. If you decide to terminate these plans early or stop paying, you may have to wait until the next annual enrollment period to pick up coverage. On the other hand, Medicare supplements or Medigap plans can be changed at any time. However, if you have had Part B for more than 6 months or you do not have a guaranteed issue period, you will have to go through medical underwriting, and carriers can deny coverage based on your health history. There are some state-specific exceptions, but for most states, this is how it works. Also, if you have had a lapse in coverage before enrolling, the supplement carrier may choose not to cover pre-existing conditions, even if they do grant you the policy. If you decide to cancel your Medicare supplement before you have other coverage in place, there is no guarantee that you'll be granted new Medicare supplement coverage. In some instances, you may never be able to get back into a supplement once you drop it, depending on your health history and circumstances. When it comes to canceling your coverage, make sure that you're aware of your options. Do your research and find out when you'll be able to pick up coverage again and what your costs will be without insurance if it comes down to that. Call your AMAC Medicare advisor at 1-855-696-7535 if you have any questions on your eligibility and the plan options in your area. They will help you figure out what you can apply for and when.